statement.
I thank the chairman for all his hard work on this issue and for this hearing. The ranking member just used the term misinformation a couple times in his opening statement. I'll give you misinformation. Misinformation is when the government told us that the vaccinated couldn't get the virus. Misinformation is when the government told us the vaccinated can't transmit the virus. Misinformation is when the government told us masks work. Misinformation is when the government said 6 feet social distance is based on science. Misinformation is when the government told us it wasn't gain of function done in the lab in Wuhan, China. And misinformation is when the government said it can't be from the lab. It has to be a bat to a pangolin to a hippopotamus to people, and then we all get COVID, right? That's misinformation from our government to the citizens. We're big boys and girls. Give us the stinking truth. And that's what this hearing's about. Why was it so important to get the licensure for the vaccine? Why? Because they wanted to mandate it on the people. Mandate a vaccine they lied to us about. They wanted to mandate it on the people. And so what did they do? They had 2 good doctors working in our government. Dr. Krause and Dr. Gruber said, wait a minute, we should follow the rules. We should follow the process. We shouldn't speed it up just because you want to mandate something on the American people that you told us things about that were not accurate. Let's follow the process like they always did. These were the 2 doctors who always handled this. And what did they do? They kicked him to the curb. They said, no, you're not doing it fast enough. The Biden administration wants to mandate the vaccine on our military and on businesses all across this country. And so they got kicked to the curb, and they sped this thing up, and maybe people were harmed because of it. And I'm not against vaccines. I wasn't against this vaccine. All I'm saying is let's do it right. And oh, by the way, let's not have good doctors like Dr. Vaughn change how they treat their patients for some political agenda driven by the government who misinformed the citizens about this pandemic. That's why this hearing's important. I yield back to the chairman. I thank you, Mr. Chairman. On page 1, second paragraph, Dr. Pavia says this: the spread of misinformation and disinformation is weakening vaccine confidence. I would agree. And I would argue that the biggest cause of that is the government. Mr. Siri, would you agree that the biggest reason for vaccine hesitancy is because of what the United States government told us about COVID and about the vaccine itself?
Absolutely, I would absolutely agree with that. I think that when you listen to a lot of the statements made about vaccines, when you express benefits that clearly don't exist, that are easily disproven, that causes vaccine hesitancy. When you say over and over it can stop transmission, when the actual studies show it doesn't. Right. The studies by the CDC themselves, when they found more nasopharynx in the vaccinated, viral carriage in the vaccinated, in their nasopharynx versus the unvaccinated, and more rates, please.
Totally agree. Dr. Vaughn, would you agree?
I agree. I think, again, they were told one thing, and then most people, once the opposite happens, usually start to question whoever told them that.
Exactly. And why do you think, well, let me ask it this way. We had someone earlier say that, I think Dr. Pavia said this. He said the way it should be determined is patients and their doctors should decide how this works. But this thing got so political that you couldn't even do that, could you? You treated, I think you said 2,000 patients in your practice, and someone just asked you a number, how many people took the vaccine and died? And you said, I can't give you a number, but you gave 6 examples of people who had huge complications in your written testimony. So tell me about that relationship and how politics played into the relationship that's supposed to exist between the doctor and their patient.
Yeah, I think the biggest trust was lost when they were mandated to get something against their conscience. And I think that is one of the things that needs to be, especially when you talk about a physician that knows his patient. There are certain patients that don't need to have their immune system, in a sense, poked. And I think most physicians would agree with that. But that knowledge is what a physician and their patient have in the relationship that exists. It is not something that is found in a parking lot when you roll down your window.
Did you ever feel pressure from any government entity, certifying board or whatever in the way you were treating your patients?
I did not. Interestingly enough, I got, some other physicians decided that when I was saying that the vaccine did not necessarily prevent transmission, they wrote the Board of Medicine. I went down and had a discussion, but at that time it was proven that I was correct. If that makes sense, it was at that time.
Some of your colleagues tattletaled on you.
Yeah. People I had never met, other physicians. The other thing was, and again, this is my 5-year-old, who basically
Say you in front of the board and you happen to be right.
Yeah,
Go figure.
going to kindergarten, I spoke in front of the board about masking my kindergartner. Again, my wife being a speech pathologist, masking children for 18 months didn't really help with their speech development, their ability to talk, and I also was turned in for that as well. Again, I asked the Attorney General of our state if I had given up my free speech when I became a physician. He told me I had not, but evidently that is not true.
Yeah, I mean, the cause of vaccine hesitancy, the reason this got so political, in my judgment, is because our government told us time and time again things that were not accurate. They told us, I said this in my opening statement, they told us masks work. They told us 6-foot social distancing, which meant we had to close schools and shut down businesses and restaurants. They told us that was based on science. They told us the vaccinated couldn't get it. They told us the vaccinated couldn't transmit it. They told us it wasn't with the lab. They told us all kinds of things that weren't true about where this thing came from in the lab. And then maybe the biggest one, first virus in human history where there's no natural immunity. Is that true, Dr. Vaughn? Is there natural immunity for this virus like every other virus?
I will tell you, again, I was early in actually having basically an immunoassay that would tell me among all my patients who had had COVID, and there's about 7,000 people that I had that database on. And up until Omicron, the reinfection rate among my people that were seropositive was basically 0.
Yeah. Oh, no, we couldn't have that. You got anything to add? Well, let me just say this, and I'll let you finish, Mr. Siri. Kamala Harris said in 2020, before she was vice president, that she would not trust any vaccine under development in the Trump administration. And a few months later, they were trying to speed up the process to mandate the very vaccine she said she wouldn't trust, because it was all based on politics. Mr. Siri, I'll give you the last word.
I'll go back to what Mr. Johnson said, who seemed very concerned about financial interests being able to influence, and I certainly agree with that. Billions of dollars were on the line for these pharmaceutical companies, and that really affected the way these vaccines were rolled out. That's a financial conflict of interest, especially when they didn't have to pay for any injuries, and they knew it beforehand because the federal government contractually agreed PrEP Act immunity would apply to every single vaccine that was rolled out. It's in the submission, the citations to all those contracts.
I yield back.